welcome everyone to the National PHPM graduation ceremony. This is the first ever Canadian nationwide PHPM graduation ceremony, so we're all very excited for you all to be here. We do have to start exactly now at 2:30, so I apologize. Je vous souhaite la bienvenue à la première célébration canadienne de remise de diplômes en santé publique et médecine préventive. That's it for French, unfortunately, but it is pan-Canadian. So we certainly have graduates from across the country. My name is Barry Pecos. I'm the program director at U of T, and I'm joining from Toronto, the traditional territory of the Huron-Wendat, the Seneca, and most recently the Mississauga of the Credit River. We are joined today by programs from across Turtle Island, coast to coast to coast, and we're grateful to have the opportunity to live and work on this land. While we'd have liked to gather in person today, we want to take this opportunity to do something a little bit different. In PHPM, we're all about frameworks, and we want to keep the most positive framing on this interesting time, which is that we're living through the greatest opportunity for our specialty to shine in anyone's memory. So hopefully we can celebrate that in some odd way. Today, we're acknowledging each of our graduates, certainly. We're privileged to have greetings today from three remarkable women celebrities, you might say, who we all know and admire and who have been the face of the response to Canada. They've made us proud, and we thank them for sharing how proud they are of us, of all of us, of our participation in training, and of course of our graduates. Before I introduce them, I want to thank Katrina Chu, our program coordinator, for her hard work, her vision, and her attention to detail. Lots of detail down to the second that made this event possible. And two housekeeping issues. If everyone could make sure to mute your line, I think Katrina's taking care of that. Unlike the provincial calls, we'll know who you are if you're unmuted. A reminder also to stay right till 3 o'clock or maybe a few minutes beyond for a special guest. It's my privilege now to introduce Dr. Dina Henshaw, who is Chief Medical Officer of Health in Alberta. She handily has led her province to an enviable place in the pandemic, at least enviable compared to where we sit in Ontario. She is a graduate of U of a medical school and the PHPM program at University of Alberta. And she's been the face of the response in her province and to some degree across Canada. And I think it's a testament to the warmth of our PHPM community that within moments of emailing her or Dr. Henry or Eileen, that they all graciously responded that they would be happy to share their warm wishes to our graduates.
Thank you for the invitation to speak at the first National Public Health and Preventive Medicine resident graduation. It's an honor to be invited, and first I want to congratulate you on all the hard work that's got you this far. When I was thinking about what to say for this event, I thought about my career path and the choices that I made to come along the path to public health and preventive medicine. And so what I want to talk to you today about is about cheese, which may seem like an odd thing to speak at a graduation ceremony about. But the reason that I want to talk about that is when I was a fourth year medical student thinking about my career path, when I learned about the specialty of public health and preventive medicine, which was called community medicine at that time, one of the things that gave me a bit of pause was thinking about some of the stories in the news at that time around cheese in Europe and centuries-old cheese-making traditions that were being threatened or at least challenged by some of the public health legislation that was requiring pasteurization. Now, this may seem like a fairly small thing, but I think what to me it symbolizes is that in public health, when we make decisions for the good of the population, there are always opportunity costs and there are unintended consequences of the decisions we make. So in the example of cheese making, obviously, food safety is critical, and we need to make sure that we're thinking about safety of the population with respect to the food that we eat. But it's also important to understand the perspectives of those whose traditional livelihoods, where there's customs of making food that draw on generations of experience, and the richness of those traditions and what we can learn from them. And so I think about something like our current COVID experience, and I think about the fact that we responded quickly to prevent the spread of an infectious disease, and I believe that that was an important thing to do. And it's also important in public health, as all of us across the country are well aware, that the actions that we took to prevent the spread of COVID had unintended consequences, which are things that are going to impact people's health for many years to come. And so in public health, I think it is important that we are humble, that we understand that we need to listen to the perspectives of others, that we consider public health ethics in the decisions that we make, and as much as possible, try to anticipate and mitigate unintended consequences when we act to prevent public health problems in one sphere, that at the same time we consider how we can minimize some of the ripple effects that might go where we didn't intend them to. I think it's critical that we think about perspectives other than our own and incorporate those diverse perspectives. Whose voices are not heard, and whose voices can we encourage and support to come to the table, not speaking for them, but those voices that we need to include in our deliberations. And so, as the new generation of upcoming public health physicians, I challenge you to continually think about all of the things that you know, that you've studied for 5 years, bringing together the infectious disease, the environmental public health, the population health elements, and incorporating those into your practice, knowing that you bring a unique perspective that no one else will bring, that your voice matters, and that none of us can do it alone, that we need the voices and perspectives of all those around us to make a complete whole. So I say again, congratulations, and I wish you all the best as you start down your journey of becoming an independent professional public health physician.
Thank you so much, Dr. Hinshaw. Over the next few minutes, we are going to have each PHPM program director say a few words about each of their graduating residents. Before they do, I want to acknowledge the program directors themselves and the faculty of all of the programs across Canada who do the work day in and day out to help train the residents who are graduating today. And I want to thank them on behalf of all the graduates, on behalf of all the other faculty. Your work is much appreciated.
I'm Dr. Karen Lee. I'm the program director for University of Alberta's Public Health and Preventive Medicine Residency program. I'm an alumni, actually, of U of T's program from a while back. And it's great that there are, so many folks who I've known either since residency or since their residency training here today as well, joining the event. So it's great to see Dina and Bonnie, Eileen and Chan here today. I want to take this opportunity to congratulate our resident, Dr. Michael Zachary, for his upcoming completion of the residency program. I'm thrilled that Michael's also been offered and will be starting a position at Alberta Health Services, our Edmonton Zone Public Population and Indigenous Health Group in July. I also want to say thank you to all the folks who've been supporting our residents, folks from my program and others who have made this day possible. And I also want to congratulate everyone here and all the residents who are completing. So congratulations, you guys.
I have had the pleasure of being the program director for Drs. Alex Choi and David McVie in their final couple of years of residency training. Alex, as an integral and valued member of the team of medical health officers at the Fraser Health Authority, you have already proven your mettle, having been thrown into the thick of the frontline COVID response only months after joining the team. David, as a Canadian field epidemiologist working in environmental health at BC CDC, you have pivoted into perhaps unexpected roles in the COVID response, and you have innovated to develop projections and surveillance systems which will support and do support public health and communities. Both of you are an asset to your teams and to the public health community. To you and to all the graduating residents, congratulations, welcome to public health, and all the best with your journey. You are already the change we want to see in the world.
Hi everyone, it's Jason Sabai, Program Director at the University of Calgary. We have two graduates from our program this year, Fernando Mejia, who's originally from Colombia. He completed a master's in medical education during his training, and he's planning to pursue his interests in clinical preventive medicine and addictions medicine when he finishes in June. Our other graduate is Rochelle Schindler. Some of you may know she played a key role in the COVID response in Calgary and helping ramp up the contact tracing and use the medical students to increase our capacity here. And she'll be joining the MOH team in Calgary after she finishes. So just want to thank the organizers and our speakers today. This is a fantastic event, and wish all the graduates across the country well in the next phase of your careers.
My name is David Kaiser. I'm Program Director for McGill, and it's my pleasure to congratulate our two residents, Yasin Cholikov and Catherine Leroux. Yasin and Catherine, who knew that we'd be having a ceremony on Zoom in the middle of the pandemic as the world burns around us? I guess we all knew that. That's why you got into public health. I just want to say you're both amazing people. It's been a real pleasure to have you as our residents for the last 5 years. And I know that you'll go on to do amazing things in the months and hopefully in the years to come. Congratulations to both of you and best of luck.
Hello everyone, my name is Julie Emily and I'm the Program Director for McMaster. It's my pleasure to introduce our graduating resident, Rabia Bana. Over the past year, she's acted in an AMOH role in Waterloo and Halton and has been crucial to our COVID response. We're sorry to see her go. We look forward to her working with us as a colleague, and I've seen her grow into a confident and thoughtful leader. All the best, Rabia, and thank you to U of T for organizing this.
I'm Maura Ricketts, the Program Director at the University of Ottawa. On behalf of the School of Epidemiology and Public Health, our Director, Dr. Melissa Browers, our Program Administrator, Andre Purdy, and all of the supervisors who contribute to our program, I want to congratulate Dr. Natalia Abraham and Dr. Daniel Myers, our two graduates this year. Daniel has a fellowship with the Canadian Institutes for Health Research, Bravo, and is going to be working at Ottawa Public Health as a medical director for response for COVID management, case management, and outbreaks. Dr. Natalia Abraham has also landed a position at the Public Health Agency of Canada. Both of them are actually working right now. But let's not forget that during the time of their training, they actually had lives, including in Natalia's case, she had 2 children during our training program. And Daniel married and has 1 child. So they've both done extremely well, and I'm proud of both of them and so happy to see them launched on their career, even in these most unusual times. I think that they're going to be very successful people. Congratulations to both of you.
Hello, my name is Corey Neudorf, Program Director in Saskatchewan. On behalf of the Public Health and Preventive Medicine program at the University of Saskatchewan, I would like to offer congratulations to our 2 graduates for 2020, Sunil Bapat and Sanaz Vasegi. Throughout their time in our program, I have been impressed with their support for one another, approaching their studies with true teamwork. I first met Sunil when he was interested in our program after completing medical school. His passion for public health was evident from the start, as he enrolled in the Masters of Public Health program even before matching to our specialty. He has approached every rotation with the same enthusiasm and teamwork. Recently, he's developed a targeted interest in occupational health and will continue to take further training in this area over the summer. Sanaz also has impressed me with her passion for public health and preventive medicine. She also had extra master's training and experience in her discipline prior to getting into our program, including working in Alberta in the area of screening and cohort studies. Throughout her busy residency, she's been well regarded for her tenacity and professionalism and has risen to every challenging assignment. She's recently been able to complete her training back in Calgary, reuniting with her family, doing an elective in cancer screening. I wish both Sunil and Sanaz all the best as they embark on their specialty careers.
I am so excited to congratulate our two residents graduating this year, our two PGY5s, Joanne Fernandez and Mike Benusik. Joanne managed to complete our program in only 4 years. She completed her MPH Epi in 2009 at U of T before going to medical school and worked as an epidemiologist at the region of Peel. She then did her MD at McMaster and then started PHPM training with us in 2015. She completed her family medicine training at Trillium in Mississauga, back in Peel region, and continued on as a locum there while she continued in our program. She completed her leadership management consolidation rotation at Peel Public Health, where she worked on supervised consumption sites and the public health modernization. Everyone remember that way back when. She is marking not only the completion of the program this year, but in the final leg in her journey of more than a decade in public health, but she's having a baby shortly. We'll be going on maternity leave, so congratulations, Joanne, for these two important milestones. Mike Benusik, one of our most animated residents, originally from a farm in rural Alberta. He went to UBC for medical school and joined us for PHPM training, reluctantly probably, in Toronto. He began at St. Mike's, where he served as chief resident, I think he did, and Paro Rep, Resident Doctors of Canada, Pan-Canadian licensure, and many other activities at that time. He then did a year of clinical training, clinical practice back in his home in rural Alberta. He did his leadership management consolidation at Simcoe Muskoka and then returned to Toronto Public Health to contribute substantially to the COVID response, even receiving a very significant award from his AMOH colleagues there, likely violating a whole bunch of Paro rules in terms of work time, but it was much appreciated. He's now back way out west, as far west as you can go, at Victoria with his wife Annalise and his cat Lady Grey. We will sorely miss both Joanne and Mike, and we're all very proud of them and confident that we'll be able to watch them accrue further accolades and achievements in the years to come. Congratulations, Mike and Joanne. And thank you to the program directors, but most of all, congratulations to all the graduates. We have to move quickly, so I want to introduce now Dr. Bonnie Henry, who's the Provincial Health Officer in BC, who of course needs no introduction. She's a graduate of U of T PHPM, as well as Dalhousie, UC San Diego, and other academic institutions. She spent some time pre and post SARS or during SARS at Toronto Public Health. When I was a resident, she was the first person that I met at Toronto Public Health, and the first person and only person to show me the org chart there, such as it was. She is almost synonymous now with the measured, calm, and directive and reassuring voice of public health in Canada, and I welcome her to address the graduates now.
Hello, I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. I've had the pleasure of meeting many of you during your residency, either during things like our public health and preventive medicine meetings, during your rotations, during the Queen's Board prep course, which I'm going to miss this year, or the many other venues that we are able to get together and learn from each other. Congratulations on making it to the end of your residency. The recent pandemic has once again highlighted the key role that we as public health physicians play in protecting and promoting the health of populations around the world, and the role that we play in preventing disease and illness. From the social determinants of health to immunizations, climate change, and of course, fighting outbreaks and pandemics, there continue to be so many issues that need the expertise and leadership we have developed through the Public Health and Preventive Medicine Residency Program. You are all well prepared to be leaders and part of our community in public health, and I look forward to working with you all on the front lines of public health across our country and around the world. Remember to look out for each other. As I often say, in public health you're never alone. Through all the crises we face, and even in our day-to-day work, we can always call on each other for advice and support. Remember to be patient, to take care of yourselves, and as we continue to address the twin public health emergencies of overdose deaths and the pandemic of COVID-19, remember to be kind, to be calm, and to be safe.
Thank you so much, Dr. Henry, for those inspiring words. That was wonderful. And now, the last of our trio of inspiring women leaders, at this time in Canada. I'm glad to call on Dr. Eileen Davila, Medical Officer of Health in Toronto Public Health, an incredibly exciting place to be, who's been the face certainly of the pandemic response in Toronto, but in the province in many ways as well. She's a U of T PHPM graduate, as well as having an MBA from Schulich. Dr. Davila.
Thank you for the opportunity to speak with you today. My name is Dr. Eileen Davila, and I'm the Medical Officer of Health for the City of Toronto. In this capacity, I have the privilege to lead Toronto Public Health, Canada's largest local public health agency, that's responsible for protecting and promoting the health of all 3 million people who call Toronto home. As you complete your public health and preventive medicine residency, you no doubt have a solid understanding of our health system and the impact of public health. The impact of public health is evident today as we continue our response to the COVID-19 pandemic. And although this has created an unprecedented amount of change, both within the public health landscape and beyond, it has also created many unique opportunities for public health professionals like yourselves to help shape a healthier future as we move forward. In closing, I would like to extend my sincere congratulations to all of you for achieving this important milestone as you embark on the next phase of your career as public health professionals. I wish you every success in your future endeavors. Congratulations.
Before we move on to our last two speakers, I want to just highlight a tradition that some of you might be familiar with at Jewish weddings, where in the midst of our celebration, we break a glass to remember that our joy has to be tempered by a recognition that there's still injustice and inequality in the world. So I want to make sure that we recognize at this time that while we're joyfully celebrating our graduates today, there are two very important and overwhelming events going on in our world. One, of course, is the pandemic, which is, while it's creating a lot of work and sleepless nights for us, is having an incredible human toll and human suffering both in Canada and elsewhere. And I also want to recognize, of course, the protests against anti-Black racism, not only in the US, but in Canada and across the world. Even today in Ontario, these two things are colliding. Some of you may know a provincial decision that takes effect today that will disproportionately affect racialized populations. So I just wanted to not dampen anybody's joy today, but recognize that that's all going on at the same time, as I'm sure you know. And that said, I'm not too worried that these words will dampen the enthusiasm of our last two speakers, because they're recorded, but they're great speakers. So we'll go for the first one now, which is Dr. Shaw, who is the inaugural program director at U of T and was instrumental in PHPM training from BC to Newfoundland. He's the author of the Public Health and Preventive Healthcare in Canada, 5th edition, on shelves now. Immediately following Dr. Shaw, we'll have a final guest with further words of encouragement. So I encourage everyone to stay online. Thank you.
Dr. Henry, Dr. Henshaw, Dr. Davila, program directors, graduates, guests, and guests. Good afternoon. My name is Chandrakant Shah. I was the founding director of Public Health and Preventive Medicine program at the University of Toronto, and also the founding author of the revised textbook, Shah's Public Health and Preventive Healthcare in Canada. I am delighted to participate in this historic national celebration, which is occurring under historic circumstances. I congratulate you, the new public health and preventive medicine doctors of 2020. It has been a long journey, and now you will go out into the world as leaders in public health and population health. As public health had to mobilize quickly to deal with the COVID-19 pandemic, I'm sure that as a trainee, you were at the forefront dealing with these crises, and as a result, you are well prepared to tackle the challenges ahead. You work closely with the heroes of this pandemic story. You are champions already. The pandemic has shown us that as a society we have not learned from our past mistakes. The COVID-19 pandemic has magnified the inequities in our society experienced by the elderly, the underhoused, the working poor, and indigenous and racialized community. In particular, we are seeing that there are communities in Canada, such as Black and Indigenous community, that have been advocating for change, social justice, and race-based data collection for years, but they have been ignored. This too is arguably a public health crisis. In future, you will have to deal with the role that racism plays in public health right here in Canada. But don't worry, you are well trained to take on new and exciting challenges, including being great champions of health equity. You are the future of public health in this country. Let me repeat, you are the future of public health in this country, and I can already tell that the future will be bright. Congratulations and thank you all again.
Hello everyone, bonjour tout le monde, and congratulations to all the graduates of Public Health and Preventive Medicine residency programs. This is the first event of its kind, bringing together programs from across the country to mark this special moment. No matter what program you were a part of, and no matter where you are celebrating, we have to acknowledge your journey and the start of your next chapter. I don't have to tell you how important your work is to Canadians. You just have to look across Canada to see the impact that graduates of your programs have had on our country. From Dr. Bonnie Henry to Dr. Howard New and many others, Canadians count on the expert advice provided by individuals like yourselves who keep them healthy and safe. That's not an easy weight to carry, and it's an enormous amount of responsibility. But you've received some of the best training and experience available to anyone in the world to tackle this challenge head on. Now, I also want to acknowledge and thank the many public health educators for their mentorship and service as leaders across all levels of government. It's your tireless work and dedication that has helped train these graduates, and your ongoing contributions are keeping millions of Canadians healthy. And we're all grateful for the work you do, so thank you. Nos médecins de santé publique comptent parmi les plus grands héros de notre époque et on a besoin de vous plus que jamais. Comme médecin, vous devez faire d'immenses sacrifices personnels et ça représente vraiment ce qu'il y a de mieux chez les Canadiens. Grâce à la science et la technologie, mais aussi grâce à votre esprit rationnel, vous nous servirez de guide pendant ces moments difficiles. As we move forward into what will be our new normal, we will continue to call on you to help protect communities across the country because we know you're ready, we know you're willing to serve, and I know that you will go above and beyond to put the health of your fellow citizens first, just like so many who've come before you. So once again, congratulations, graduates. I wish you all the very best in the years to come. Merci.